It's so important for leaders at the top of organizations to keep learning, stay sharp, grow their networks. To help our audience better do this in a more simplified, personalized, and meaningful way, Becker's Healthcare has launched My BHC. It's your trusted Becker's Healthcare experience and more, with content, connections, events, and learning opportunities. Join the community free of charge at www.my.beckershospitalreview.com, and we'll see you there.
This is Scott Becker with the Becker Private Equity Podcast and the Becker's Healthcare Podcast. We are thrilled to be joined by a brilliant leader and doctor. We're joined today by Dr. Claudia Cotca. Dr. Cotca has a fascinating background. She's both, for better or for worse, a graduate of the University of Michigan. Now, my disclaimer is I've had two kids go to the University of Michigan, but I grew up not cheering for the University of Michigan. So I've grown to learn to sort of kind of love it, but not Michigan sports. But more than a Michigan graduate, she's also a Master of Public Health, University of Michigan School of Dentistry, and just a sort of brilliant, well-rounded professional and leader. Also a professor. Dr. Cotca, take a moment and tell us about yourself and maybe what you're most focused on today.
Thank you so much for that. I appreciate being here. Thank you for the invitation. It's really a privilege. I think as a healthcare expert, first and foremost, my heart is in the clinical realm of delivering therapeutics to patient care. And so that is what I had dreamed about at the early age of 5. And that's what I knew I was going to be. Granted, that was in Romania. And now, of course, being in the United States, I never really thought I would be so involved in the global extensions of policy, regulatory, venture capital, even extending to the commercial real estate investment funds, if you will, that really intersect in the healthcare commodity space and transact in the sector. And more specifically, being able to contribute and guide leaders in at the C-level leadership suite, to make better decisions that really decrease comorbidities and that really optimize therapeutical, I would say, customization and precision medicine that a lot of people, I think, are very thrilled about conceptually. However, in practice, it really requires a more customized verification analysis of the technology and, of course, optimizing it for that particular patient. Being in Washington, D.C. has given me a great deal of interactives in this particular way and sense, and has brought me to the global market. And inevitably becoming a healthcare analyst of the healthcare commodity space has certainly thrown in a lot of thrill. However, I think it just calls for, the generic Hippocratic license practitioners and subject matter experts to contribute and lead the direction of the sector by autonomous responsibility of the profession, of course, the population whom we serve at large.
Thank you. And talk a little bit about when you look at the world of business, investment, technology, dentistry, what are you most focused on? What trends are you watching the most closely? Tell me the 2 or 3 trends that you're the most focused on. What do you see out there?
Sure. I'll start with the most I would think relevant in terms of concern. It's coming, of course, from the commercial real estate aspect investment, because it is by and large going to dictate what access to care is for the public at large, from more managed approaches to delivering more fee-for-service based systems, as well as more illustrious availability of services to those who actually wish it. And aside from that, of course, we have the venture capital investment segment, which pulses incredible, I would say, pressure points in terms of what gets to the marketplace and what penetrates. In terms of and the clinical sense of what actually should be prioritized is really the comorbidities, what to choose, what therapeutics and what interdisciplinary voices of experts need to come to the table to really address the comorbidities issue, which has not yet been fixed and hopefully is going to be corrected by the artificial intelligence or mathematical digitization algorithm sequela, as well as we have a great deal of repertoire of technologies already existing in the last 2-3 3 decades that really has not been taken to heart by even the subject matter themselves. I'm talking about clinicians specifically, because we are really the ones that render therapeutic delivery to patient care and the end consumer. But customizing that particular technology, and particularly, for instance, optical laser technologies coming from the visualization, imaging side, diagnostics, all the way to the interventional side. And I think that, having a sense of the already unutilized repertoire of collective and ignoring that would significantly continue to increase comorbidities in the market. And mind you, when we speak about comorbidities, really, we want to look at mechanisms of action, diagnostics that really focus on etiologic diagnosis, meaning cause and effect, as opposed to correlational. And this is something that only a professional and subject matter experts can really lead the entire sector to make better informed decisions as to where investments ought to be and what are the contributing voices that would be able to platform that. So I would say, outside of day-to-day practice care, my specific focus has been to look at technologies that really affect phenotypes in the population, particularly, for instance, comorbidities like obstructive sleep apnea, temperamental disorders, a lot of autoimmune conditions in the oral systemics, for instance, that can easily be addressed and much more effectively addressed with optical laser technologies, to come and customize the technologies, and from a perspective of consulting and the C3 Think, for instance, side, looking at that opportunity and actually engaging that for the past 20 years with credibility has been thrilling.
And tell us about that. Tell us about C3 and what you do there.
So basically, Hippocratic Oath license gives the various different expectations from the providers and the licensed clinicians. And one is, of course, do no harm. But the other aspect really highlights the necessity that if knowledge base is achieved on a particular axes of demand by the clinical phenotype or the clinical condition, even though it has not been proven, it actually it is required to be presented to the patient, of course, and the patient always makes decisions whether or not they receive any treatment at all, to any specific treatment. Of course, all considerable liabilities and incur consequences come along with those choices, with any of those choices. And so that approach to take seriously the collective technologies like laser technologies, microscopy. For instance, it's really inevitable to not use or to not use or to side by, for instance, microscopic viewing, let's say, when considering a laser optical interventional as well as light therapy or light technologies evaluation. And so optimizing the technologies that are available in whatever package on the market, of course, and taking that to further customize the protocol for a particular segment of population, but also specifically in real time. So one of the things that the think tank has been partnered with the Institute for the past 25 years, specifically to focus on real-time implementation of, first of all, profiling patients from an all-systemic mechanism-driven profile, meaning understanding where are the obstacles, where the host deficiencies lie, why the therapeutic outcome index is not achieved because of toxicity, clinical nuances of the technology, which oftentimes are not being discussed, when we're looking at the FDA, let's say, clearance levels, because a lot of exclusion criteria is not really taken into consideration. However, our population has been differentiated significantly in the last 10 years, 20 years, and we have to accommodate for that. So the approach, I think started really when I was a student at the University of Michigan, taking courses at the School of Business, of course, with a myriad of the interdisciplinary core sciences and dental focus that I had, understood that an incubator type setting would really promulgate a position the small entity of diagnosis, treatment planning, and of course, rendering therapeutics in a very, very creative and productive way that really affects directly and indirectly the existing comorbidities in the immediate and also distant geoposition. And so, taking that seriously in terms of optimizing that, there is a expectation, of course, by every provider to customize it for their particular patients. And we take that very much to heart. I think we are very we are actually probably still remaining one of the still the first unique composition of that particular combination or duo, if you say, between think tank and a clinical institute in the private sector. I know this has been done well in terms of the academic sector as well as the large enterprises, but in the small business equity or private sector, which really the pulse of therapeutics are being exchanged in masses, it has not yet been accomplished. And so it's a privilege to be able to be the first and pioneer this fundamental availability and privilege to practice in a way that I think only this particular era of scientific discovery has really allowed us to have the choice of therapeutics be available to us.
Dr. Cotca, one more question, and really it's a two combined question. The title C3, where does that come from? And then second is where do people learn more about what you're doing in C3?
Sure. So C3 really comes from just my full name, Claudia Cotca. It wasn't easy, I would say, easy rendition. It was almost automatically. I'm very, as creative as I am on the artistic side, for me, mathematics comes rather naturally. So, and then the availability for us to discuss and impact and collaborate and contribute, from large enterprise solutions to a small, model systems. We can certainly be reached at c3thinktank.org. I'm also on LinkedIn, readily available under Claudia Cotca or Claudia Z. Cotca. And of course, those who want to learn more about various different ventures, other websites are at claudiacotca.com.
Dr. Cotca, I want to thank you for joining us today. Just a pleasure to visit with you. Thank you so much. Joining us on the Becker's Healthcare and Becker Private Equity Podcast. What a pleasure to talk to you. Thank you very much.